Thank you, everyone, for joining us. We will be starting shortly. We have one more director that should be pulling in the parking lot momentarily for a quorum. Thank you.
Don't you love how Kimberly and my backdrop matches?
Now that we have everybody here, call the meeting to order. Roll call, please.
It is 4:07 PM. Director Shore,
Here.
Director Perezio,
Here.
Director Delara,
Here.
Director Logston,
Here.
Secretary Baraza,
Here.
Vice President Rodriguez,
Here.
Rogers.
Here. Will you please join me in the pledge of allegiance? Your heart, ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Next on the agenda is approval of agenda. Any item on the agenda may result in board action. May I have approval of the agenda, or if anybody wishes to remove
Yeah.
anything from the agenda?
Move approval of the agenda as is.
I'd like to make a motion to pull one item from the agenda and discuss it later. I think it is the from the district.
It's,
I think it's number one. I'd like to request pulling one off the agenda today for further discussion. Maybe in a pull-out breakout session meeting to kind of go a little more detail into some of the information regarding the GME program, getting a little more information into how this is going to be implemented, its long-term impacts. I just have some concern as I've kind of gone through it in detail with how it's going to be executed. I think it's the right mission, the right idea. But I think if we rush the execution on something this big and this important, we're not only risking kind of the identity of what we're trying to do, but we're going to impact some of the residents and the physicians coming in into the program that we want to recruit. So I think I'd like to take a little more time to pull that for now and then bring it back up after we kind of go over some more information.
did you intend to table it for another meeting?
I'd like to table it for another meeting. I'd like to spend some more time to look at it together and bring up some more information. I think I've reached out to a few people here already regarding the comments. I don't know, but so that would be my request, is to do that now and then to table it and bring it back. I know. We're all connected. September.
Can I get clarification though, as I think we're only voting to pull anything from the consent agenda at the moment? And that motion would be more in order when we get to that item under that business section.
No, it's, I think he's made a motion, he's gonna have to get a second, but he's talking about, delaying consideration of this item.
Okay,
Different than pulling it from the consent agenda, if I got that correct.
Yeah, I'm not looking to vote on that today.
Okay,
Maybe we'll bring it back.
in order to consider that, you're gonna need to, get a second on your motion.
Okay, all right, I'll look for a second then.
I'll second that. I have some serious.
Sure. I already made a motion.
Is there-
Oh, okay.
Is there a second?
Second,
No, I
No,
don't think
you already seconded the tabling of it, Art. We,
that's what I,
Director, need a motion to approve the agenda and it needs a second for a vote. Is there a second?
with or without the removal of the item,
With that,
Without.
I submitted.
with, yeah, without. So is
Mr.
it,
Delara's motion is to approve the agenda as is.
Correct.
So we need a second for that.
I'll second that.
you can't second it, Art.
You can if you want to.
Oh, you,
The motion for all directors is to approve the agenda as is without any removal. So that's the motion on the table. And it's looking for a second at this point to approve it as is with all items on the agenda.
I'll second.
Director Rosa seconded it. Okay, may we have a vote? Probably should do a roll call vote, please.
Okay, Director Perez Hill,
No.
Secretary Baraza,
Yes.
Director Delara,
Yes.
Director Logston,
No.
Director Shore,
No.
Vice President Rodriguez,
Yes.
and President Rogers.
No. So it's motion.
To 4-3, so it does not carry.
Then I'll do I need to restate the motion to just table that for another meeting for further discovery? Item one.
I'll second that.
May we have a roll call vote, or do we need discussion on that?
I would like to make a comment on that.
Sure.
Okay. So I do have a problem about continuing this item. I know that that it's good to talk about and be able to provide information and ask questions after we provide the information and after we discuss it. If the board does not feel comfortable in making a decision, you can continue the item and continue talking about it. It doesn't have to be acted on today. I think that is a good opportunity to actually process information that you get and think about it over time. If you're not able to make a decision, you don't. So I understand that you have concerns, and I'm looking forward to hearing those comments. I would like to hear those comments tonight. That way I could learn more about my fellow board members' comments and opinions. I know I did my homework coming here today, but I know I don't have all the answers. And so I would like to hear this topic that that was acted on by the program committee and the staff, and if there's more to hear from other members that have not participated in the process besides the written reports, then I want to hear from you and from others. So I hope that we can start the discussion, because you're right, it is a very important topic. And if it requires more than one meeting, then I want to start hearing about it now. So I'm hoping that the board will reconsider and open the conversation today so that we could start learning about this topic.
Are there any more board comments? May we have a roll call vote?
Actually, I do have a comment. My hand's raised. I'm in agree with Letty here, and I actually agree with Dan on this as well, and agree that there should be some type of working group. We've had a number of letters of support for this initiative, and if you look at the overall initiative, the importance of expanding access to providers in the region is crucial. I agree with Letty that it doesn't, and sorry, Director Delara, but that I just don't want us not to discuss this, and we don't have to go into an hour-long discussion tonight. But again, I want to hear Director Logston's comments and suggestions, and agree that I believe that we should probably establish a working group immediately that involves Intercare and the other players in this to make sure that we're establishing a program that is not only beneficial to the Valley, but more importantly, what is the district's role in this too, and how we can play an active role in making sure that this is one of the most successful residency programs in the region. I just don't want to table it for another day right now without that discussion. I'd rather have a little discussion with a little information and some of the concerns from Director Logston's or any public comments, and then us make a recommendation to move ideally into some type of ad hoc working group.
Thank you. Well, my comment is that I agree that this is a very important program and something that's desperately needed for the Valley. But along with Dr. Logston, I have some questions about its success, and I think that could be accomplished in a more detailed working group with more time than we have tonight at a board meeting, and that we would schedule it so that we have more time to discuss it in more detail. Any more comments?
I feel the same way as Director Logston. It doesn't I don't feel easy approving something like this without discussing it further. There's a lot of things that are missing from the grant, right? Like the program the program person. There's just a lot of things that are missing. I know that we do need it in the valley. I know that it is something that is important, but I would feel more comfortable voting on it to go forward once everything's in place. Cause then we're not putting them in the if and what if not, what if this and that. You know, everything's already said, this is how it's gonna run, this is who's gonna do it, and that's the only thing that I feel this.
Director Loxton, would you consider amending your motion and saying something, we're gonna have a preliminary discussion, we're gonna open discussion, but we're not gonna vote on it, but it'll be a discussion. Would you be open for that?
Sorry, can
She
you,
wants to know if if he would be open to changing his action that he made, recommending that we discuss it now and not making that.
That we start the conversation now and not necessarily look at making a decision tonight.
The only concern I have with starting it now is that it's a very, very big topic. You know, I could speak to this for probably an hour and a half. And I think the reason I made the motion the way I did is I think it's probably better spent in a working group with a lot more detailed focus. If you want a little bit of a 2-minute overview, I can give some of that now to give some context, but to really get the full understanding of what I think needs to happen here, it's going to be an intense conversation. I think I was trying to respect everybody's time. I was trying to respect the open conversations that we probably need to have in a working group before we bring everything out publicly, just to make sure we have an idea of what we're going to discuss here. I'm happy to do either, but I think my recommendation would be I can give some context, but opening it up for discussion, it's going to be a very long discussion tonight because there's not really a stopping point once you start discussing. And that's why I would prefer to just continue the table motion. Happy to sit on the working group as soon as possible to do that.
Madam President, I have one more comment. Okay, so this is the approval of the agenda. So if it doesn't get approved to as part of the agenda, the public has the opportunity to speak on the item. You have you're still gonna have it.
Yeah.
Okay, so in light of what you're saying, Director Logsdon, in respect for people's time, people have made the effort to be here tonight. Some of them have come long distances to be here tonight. I don't think it's very respectful of our public to not continue with the conversation and to give them the opportunity to do so in a transparent public setting.
Sure.
We start the conversation. If there is probably going to generate some other questions that can be addressed in a continued forum, whether it's a working group or next month's meeting. But I think that in light of what you're saying, transparent, respectful of people's time, I do hope that you will reconsider your motion to allow us to start the conversation tonight.
So just for,
I feel
okay, sorry.
I feel that we all understand what the importance is in this topic and what it signifies for the community and for everybody all around. But I don't think that we should keep on pressuring somebody to change their idea or their motion once it's already been made. Just like your motion was made and it didn't go through, we still don't know what's gonna happen with this motion, you
It
know?
was public, it was
Yeah.
board discussion and I offered an
and
opinion.
the public will have a chance tonight to speak on it as a non-agenda item. So may we have roll call, please?
And this is to remove item one from the agenda based on the different comment. Table it. Thank you.
Yes.
Director Perezquio. This is to table item
Yes.
F1.
Table, yes.
Secretary Baraza,
No.
Director Delara,
No.
Director Shore,
Yes.
Director Logston,
Yes.
Director Rodriguez,
No.
and President Rogers.
Yes.
So the motion moves 4-3.
Next on the agenda is public comment. At this time, comments from the audience may be made on items not listed on the agenda that are of public interest.
motion to approve the agenda.
Say again.
Oh, we need
We
to
have to approve
approve
the
it
agenda.
without the,
Oh, thank you. Thank you,
Okay.
council. May I have a motion to approve the agenda as stated?
This minute.
Second.
All in favor, please say aye.
Aye.
Yeah, who moved the agenda?
I thought he had originally moved it without that item on the agenda, so I thought we.
That's what I thought. He moved the agenda right to take
Without
that
that
item and everything.
Okay, maybe I didn't get it. I got the impression it was to continue that item on the agenda.
No.
It wasn't it wasn't approve the agenda and continue that item. Now,
It was to pull the item from the agenda.
yeah,
Correct.
Which
Correct.
one?
to continue.
Theoretically, that you're pulling the item from the agenda, so you're approving the agenda without that item.
Okay, I just didn't get the second half, but
Okay,
that's why I
Okay.
spoke up.
so we're good. Roll call.
What are we
I
doing? Roll
think
call.
it's
We're
already
done.
All in favor, say aye.
Aye.
Said no.
And opposed.
We
No.
want comment, thank you,
Public comment.
for items not on the agenda.
Okay.
No.
The board has a policy of limiting speakers to no more than 3 minutes. The board cannot take action on items not listed on the agenda.
Excuse me, President Rogers, we're still having discussion here, and I guess to make sure that the vote was accurate, let's do another vote approving the agenda, but tabling item F1,
For the record.
right?
Or you could just say approve the agenda as amended. That's all.
Okay, we're voting.
I
to-
make a motion to approve the agenda as mentioned.
States.
Second.
All right. All in favor, please say aye.
Aye.
Because we have to.
We can do a roll call. Okay, roll call, please.
Wait a minute, I actually have a question. In most of these types of motions, if you're gonna table an agenda item, you table it to an effective date. So I would like to make a friendly amendment, if it's accepted, to table it to the next district board meeting.
Next district board meeting will be in September.
September.
I'll second that.
Thank you.
May I ask a question for clarification? I thought I was understanding that maybe a study session or a work group, that's different from the next board meeting.
I think the conversation to have a study session and work group should happen before the next board meeting, but I think this needs to still be agendized for the next board meeting.
When do we have our strategic plan?
September, we haven't defined those. Once we get strategic planning consultant approved, then we'll work with the consultant to schedule those work groups for working sessions.
Okay, so do I have to make an amendment to the
We have to vote on his.
motion that I made?
Yes.
Okay,
So I make the motion to approve the agenda as is, removing F1 from the agenda and to table it until our next board meeting in September.
I'll second that.
roll call.
Okay, Director Perezio,
Yes.
Secretary Barraza,
Yes.
Director Delara,
No.
Director Shore,
Yes.
Director Logston.
Yes.
Vice President Rodriguez,
Yes.
and President Rogers.
Yeah. So now can we move on to public comment?
Now we do public comment.
Can I actually ask that a direction for staff, and Jeff, tell me if I'm out of order here, but that a working group or ad hoc committee be established prior to the next meeting?
I think that's understood.
That's-
Okay.
That's up to the president. She has the authority to do that.
Yeah, that's understood and we will convene one. before the
Okay,
next-
great.
You have
Thank
to
you.
state that you're creating it. So are you stating that you would like to create an ad hoc
I will
committee?
create an ad hoc meeting of a special meeting of the board because it needs to be all of us, a public meeting where we discuss.
Well, she doesn't have to, she's got the authority under the bylaws to simply create an ad hoc task committee on this item. We don't have to have a special meeting. That's all. You can do it on your own.
All right, good,
Okay?
good.
Okay,
Thank
thank you.
Is that clear with you, Director Rodriguez?
Yes.
Okay.
So since you are creating this ad hoc committee, would you would you ask at this time who's interested in serving on that ad hoc committee? So we could know?
I would like to see all of us present because to make it a public.
And have a quorum for ad hoc.
A regular meeting.
Then it becomes a
Have to
regular
be
meeting.
your 3 members, like,
Well,
I would
Well-
actually like for it to be a full board discussion and not just an
I
ad
think
hoc.
so it cannot be ad hoc committee. then it'll
Right,
be-
not an ad hoc committee, it's gonna be a full board.
We'll,
special
we'll
meeting.
work together with the president to establish a special meeting of the board to have all directors involved with this work session.
There we go.
That's great.
Back to public comment.
Public comment. So I think that the public has the idea that we have a 3-minute limit on the time and we don't take action on any items that come up for discussion. Also, please acknowledge the fact that even items that are on the agenda where the public needs to speak, we still have a 3-minute time limit. So at this time, we can take public comment even on item F1.
Right, for items that are not on the agenda. For item F
Items
that
not
have been
on the
removed.
agenda, including item F1. So do you have,
Yeah, we have public comment cards, bottom.
would you come to the podium, please?
Thank you. Thank you, Madam President. If you allow me, I would like to translate for some members of the
Of course.
public that are Spanish speakers, because they probably haven't understood what's going on. La mesa directiva ha tomado la decisión de demorar la acción sobre este artículo que hemos presentado de este grant para la reunión del día de septiembre, del mes de septiembre. Sin embargo, hoy pueden expresar sus opiniones, su criterio al respecto de lo que ustedes venían hoy a decir. Yo voy a decir unas palabras y agradecerles a ellos por tomar esa acción y por mantener este trabajo vivo con nosotros, porque sabemos la importancia que esto tiene para nuestra comunidad. So, thank you, Madam President. On behalf of InnerCare, I'm Dr. Conrado Barza. I'm Vice President and Chief Academic Officer of InnerCare. It's an honor to be here, and I'm really appreciative of the thoughtfulness, the action that you're taking today, the continue the conversation. I do want to say that InnerCare is ready, and I want to highlight a few of the things that we have prepared to make sure that this is ready. InnerCare proudly became, in May of this year, the first federally qualified health center-based ACGME accredited sponsoring institution in the Coachella Valley, a milestone that reflects our collective commitment to addressing the physician shortage and advancing health equity across the region. The 2023 Huron report identified a gap of 236 physicians in the valley, most of them in primary care. Our program directly addressed this need and aligned with Besser Healthcare District Goal 2, expanding access to healthcare. We're especially proud of the strong support that our program has received, and you have received copies of many letters of support, including UCR School of Medicine and Congressman Dr. Raul Ruiz, who is an emergency medicine doctor, Martin Macielo, who's the CEO of Eisenhower Health, and other physicians from the region that are seeing the impact of physician shortage in the region. We are also very proud of the partnership that we have with Eisenhower Health, Pioneers Memorial, BAP Health, Imperial Valley Healthcare District, and we have created a multilateral Graduate Medical Education Committee, or GMC, a collaborative governing body that provides oversight and strategic guidance for this transformative program. InnerCare has already committed over $6 million in organizational resources to launch and sustain this program, demonstrating our financial and operational readiness. As one of the largest FQHCs in the region with more than 600 employees, including 86 medical providers, we have the experience, capacity, and infrastructure to implement this program effectively. In addition, and in partnership with San Diego State University, we have secure NIH grants to create a clinical research opportunity for our residents, further enriching the educational experience and supporting our commitment to advancing health equity through the region. And we view this finally as a transformative community partnership. We really welcome, and we have welcomed the healthcare district from the very beginning, because we see the alignment between the strategic plan of the healthcare district, the body of work of so many years with the community health needs assessment, a community health improvement plan, the Huron report, and then a strategic plan that really outlines the work that InnerCare is proposing. And we envision this as a true partnership between InnerCare and the district, one of shared leadership, vision, and commitment, working together toward a stronger Coachella Valley with better healthcare infrastructure and equitable access for all. Thank you very much.
Thank you.
Next public comment.
Okay, I'm trying, sorry, I think this thing stopped. Next is Dr. Alan Wu.
Madam Chair, and board members, thank you for allowing me to speak today. I'm Dr. Alan Wu. I'm an OBGYN by trade and also the Chief Medical Officer for InnerCare. I'm also a lifelong Coachella Valley resident. We keep home in Little Falls near Eisenhower, and I've kept privileges there since 2007 as well, and have been supported by Eisenhower Medical Center, consistently taking call for GYN services over there. Recruited by InnerCare, and when I found out I would have the ability to do indigent care and to help those in need, and through a well-organized system, I just totally fell in love with the program, and then went on board with them and have been with them for the last 10 years. It's a fantastic organization, highly organized, and one of our oldest FQHCs in the United States. This organization was part of the brain trust and brainchild of Cesar Chavez, the farming advocate. And because of that and that history, we are one of the longest standing FQHCs, and an FQHC that is highly savvy, that has invested heavily in technology, and is one of our most creative and innovative FQHCs in America. And that's why I'm here as a proud member to tell you that we are ready. We have been doing residency training for over 20 years. We have been doing it for UCSD, Scripps, and also Eisenhower. We do not just speak to it, we actually do it. And I know that there is concern whether or not there is adequate infrastructure and whether or not we have an adequate program. But we know, practically speaking, we know the ACGME issues that our teaching institutions refer into us. We know what these residents need. We know what their requirements are. We know exactly how many deliveries they need. And that is one of the most difficult things you will find for any residency program in America, the deliveries. And I will tell you, as an OBGYN, we've had inquiries as far as Los Angeles for people wanting to come into the Valley and take our deliveries and utilize them for their education. We are at a critical nexus of junction here right now. We have a tremendous opportunity to have control of our own education system and recruitment for talent. I am telling you honestly, as a chief medical officer, it is very challenging to recruit people right now. There is a physician shortage. We are feeling it. And we can no longer trust and believe in just recruiting and going out there and trying to find people. We will have to generate our talent eventually. I just wanted to say thank you to all the board members. God bless all of you, and God bless the work that we do, and thank you for your time.
Thank you. Thank you, Doctor.
Yesenia Posada.
Yo solo hablo español. I just stepped out. Did he time that right or what?
How do you translate?
Please do it. Please. Thank you.
Mi nombre es Yesenia Posar, soy de la comunidad de North Shore, somos de la organización de Unidas por Salud.
My name is Yesenia Posar. I'm from the community of North Shore. We are from the organization United for Health.
Yo soy promotora purépecha.
I'm a health promoter from the Purepecha community.
Yo lo que he escuchado en estos años de mi comunidad
What I have heard from my community throughout the years
es que ellos tienen miedo a ir a las clínicas por falta de doctores que hablan español.
that they're fearful of going into a clinic because there are not enough doctors who can speak Spanish.
Ellos me han comentado que han tenido malas experiencias en las clínicas Meca y Coachella.
They have expressed to us that they have had bad experiences going into clinics because the doctors don't speak Spanish.
Entonces me gustaría que hubiera más doctores que hablaran español.
And we would love to have more doctors that can speak Spanish.
Eso es lo que me gustaría para mi comunidad purépecha. Yo hablo por mi comunidad purépecha.
That's what we would love for our Purepecha community, and I speak on behalf of our Purepecha community.
Gracias.
Thank you.
Thank you. I know.
Geez, it's reset it. Press the delete.
Mary Batista. Mari Batista.
Andrea, can you reset the time?
I can't. We have a freezing issue right now.
We've got her on the phone.
Buenas tardes a todos.
Good afternoon, everybody.
Mi nombre es Mari Bautista, también del grupo de Yesenia, Unidas por Salud.
My name is Mari Bautista and I also belong to the same group, Unidas por Salud.
Nosotros somos un equipo, una organización que nos centramos en el este del Valle de Coachella,
We are a group that focuses our work in the eastern part of the Coachella Valley.
trabajando con una clínica que hacemos, una clínica gratuita una vez al mes para nuestra comunidad.
We operate a clinic once a month for our community.
Mi área estoy trabajando ahorita con la salud mental.
I'm currently working on a project on mental health.
En mi experiencia hemos visto una necesidad muy alta
In my experience, we've seen a high need.
y lo tomamos en un nivel de un 100%. Yo he visto un 85% de la necesidad de nuestra comunidad que requiere salud mental.
If we put this on a scale to 0 to 100, I see that our community has an 85% need for these types of mental health services.
Hay una necesidad tan grande en cubrir esta área de la salud mental y desafortunadamente no encontramos doctores que puedan cubrir esta necesidad. Estamos teniendo mucha dificultad para encontrar dónde colocarlos, cómo acomodarlo a toda esta comunidad y tenemos un índice muy alto de personas que se acercan con nosotros nos están diciendo que están pensando en suicidio. Esto ya nos lleva a pensar en una emergencia y para nosotros este trabajo lo hacemos con mucho amor y con mucha pasión para nuestra comunidad.
So currently through our clinic, we are seeing a high demand for the mental health services We are seeing some symptoms of mental health issues, including suicide. And obviously the demand that we see out in the community is not matched by the number of professionals that will be able to help our community deal with these issues.
Nuestra comunidad en la mayoría es una comunidad agrícola, campesina,
The majority of our community is a farm working community
y de habla español.
and Spanish speaking community.
Entonces, si nosotros podemos educar en salud mental a un padre, a una madre, vamos a tener una familia sana, una escuela sana, una ciudad sana y una comunidad más sana, donde podemos crecer todos a un nivel tanto académico, emocional, físico, mental, y nuestra comunidad puede crecer también a un nivel socioeconómico, que tendremos que nuestra demografía está muy mal con nosotros.
If we're able to provide these mental health services to the family unit, the parent and the mother, it's going to extend out beyond that core family unit into schools, into our community. And we're also going to be able to see academic progress increase, within our students. And also, it could also be an economic driver for our communities in the East Valley.
Muchas gracias y yo sí invito a que tengamos más doctores de salud mental y que hablen español para que se sientan cómodos en nuestra comunidad. Muchas gracias.
And I make the petition that we, increase the number of Spanish-speaking mental health providers so our community feels welcome and at ease seeing these types of providers.
Thank you.
Thank you.
Balthazar Aguilar.
Afternoon, board members, thank you for your time. Here in support of Intercare's grant proposal. This proposal that reflects us. It serves our immigrants, community, farm workers, Spanish speaking and indigenous speaking families. Today, over 70% of the residents in these target areas are Spanish speaking. The program includes a cultural and linguistic training as part of its curriculum. It's training next generation of community-based physicians. This isn't just a one-time service, it's a pipeline to bring and keep doctors in our region. 75% of residents who train in California stay to practice here in the state. EAP Health and Intercare will together train up to 36 residents by 2029. It is a community-based led solution, not a competition. This is not a top-down initiative. It comes from trusted local clinics that have been here for decades. Intercare is already a backbone for care in our region with partnerships across hospitals and nonprofits. DHCD's strategic plan emphasizes that it should fund and support organizations like Intercare that are expanding access to healthcare for our residents. This program has a strong ROI for community health. It's not just spending, it's an investment in long-term health and healthcare access. Each resident sees thousands of patients during training. Intercare estimates over 21,000 additional patients visits per year. Even retaining half the graduates will result in permanent improvement in healthcare access. The proposal reflects health justice. This is about dignity. People in our rural communities that deserve the same access to care as anyone else. Many residents live in federally designated health professionals, designated HPSA. This initiative will reduce emergency room overuse, unnecessary suffering, and long waits for care. Thank you.
Thank you.
Thank you.
¿Puedes decir en español, Baltasar? Español.
Español.
Good one. Next.
I think it would be a good idea. We have a translation. If you could summarize it, Alejandro, please.
Yeah, so lo que está expresando Baltasar, que obviamente hay una necesidad muy grande en el Valle de Coachella para doctores que reflejan a la comunidad que están sirviendo. Personas que hablan español, personas que están entrenadas en la cultura latina para poder servir a nuestra comunidad mucho más mejor. Y hay programas comunitarios cómo los programas que ahorita están proponiendo a través de esta propuesta va a incrementar el número de personas, de doctores que van a servir a nuestra comunidad, que sean más latinos, que hablen español y que se queden en nuestras comunidades, que vengan y se entrenen a través de este programa, pero que también sigan aquí trabajando en las diferentes clínicas, los hospitales, etcétera, para que sigan apoyando a nuestra comunidad, porque sabemos que las esperas a las citas son muy largas, etcétera. Necesitamos más doctores que hablen español para poder servir a nuestra comunidad. Y también Purépecha, si se puede. ¿Verdad?
Gracias. Next.
Cruz Rangel.
Cruz.
Bruce.
So I'm gonna say it in Spanish, right? Okay. Buenas tardes, mi nombre es Cruz Rangel, vengo de la ciudad de Termal. Vengo a hablar aquí sobre mis vecinos, representando a mis vecinos del área de Termal, Meca North Shore, Salton City y el Valle de Coachella. ¿Termino?
¿Te lo vas a saltar en el... ¿Te traduzco?
Sí, pues traduzco usted, así nos vamos.
Mi nombre es Cruz Rangel y trabajo para la Fundación de United Farm Workers. Hi, my name is Cruz Rangel. I'm here representing the United Farm Worker Foundation, and I'm representing the cities of Thermo, Mecca, Oasis, and North Shore, representing my community here today.
Necesitamos más doctores, como los mencionaron los compañeros de nuestras comunidades, y aquí está el porqué. Ahorita mismo nuestras familias, ¿verdad? Esperan meses para ser atendidos en las clínicas que nos representan aquí en el Valle de Coachella. Algunos otros tienen que viajar lejos fuera del valle para ser atendidos.
So dame tantito, sí. No te me vayas a decir porque se me olvida. Muy bien. Part of the reason why I'm here to talk to you today is to talk about the need for these types of services in our community. And I'm going to tell you the reasons why. The first reason is that our community members, they have to wait months to see a doctor in their own clinics. They also have to travel very far to seek some of these medical services. Oh, gracias.
Pues déjame ver en español del segundo punto. Nuestras madres y nuestros bebés, ¿verdad? Embarazadas sufren por encontrar doctores, para encontrar los servicios básicos cuando están en gestación. Como dije antes, muchos tienen que viajar lejos para dar a luz, ¿verdad? Este programa va a entrenar a doctores para cuidar de nuestras mamás y de los bebés aquí en este valle.
The second point of why we need these programs is our mothers and babies need help. Pregnant women struggle to find doctors nearby. Some have to travel far just to give birth. This program will train doctors to care for moms and babies right here in our valley.
Necesitamos doctores que nos entiendan. Muchos de nosotros hablamos español y purépecha. Necesitamos doctores que nos entiendan y que respeten nuestra cultura. Este programa va a enseñar a doctores no solo a escuchar, sino a entender de la forma correcta hacia nuestra comunidad.
We need doctors who understand us. Many of us speak Spanish, Purépecha. We need doctors who speak our language and respect our culture. This program will teach doctors to listen to us and care for us the right way.
La mayoría de los doctores que son entrenados aquí en California se quedan aquí en California. Do I continue or just start?
You can continue because you're translating, so
Thank you.
there should be given a.
Thank you so much.
Yeah.
Eso hace que los doctores se queden en nuestros pueblos así de una vez por siempre. Este programa va a traer a 36, como lo mencionaron anteriormente, 36 nuevos doctores a nuestro valle para el año 2029.
We need doctors who stay here. Most doctors who train in California stay here for work. That means more doctors for our communities for good. This program will bring 36 new doctors to our valley by 2029.
Estos doctores cuidarán de nuestros hijos, de nuestros papás y de nuestros abuelos, todo en un solo lugar. No más tener que manejar fuera del valle a diferentes ciudades, a ver a diferentes doctores.
This initiative helps the whole family. These doctors will care for children, parents, and grandparents all in one place. No more driving to different cities for different doctors.
Nuestra juventud puede convertirse en doctores. Nuestra juventud se puede quedar aquí y entrenar aquí en el valle, sin tener que dejar su origen, su pueblo, ¿verdad? Que es el Valle de Coachella. Este programa va a crear trabajos y se mantendrán aquí en el valle para los doctores que se vayan desarrollando aquí en nuestra comunidad.
Our youth could also become doctors. Young people here should have the chance to train as doctors without leaving home. This program will create jobs and keep our future doctors here to serve our community.
DHCD, necesitamos su ayuda. Sus reportes lo mencionan, necesitamos más doctores aquí en el valle. Esta es su oportunidad para hacer el cambio real. Estamos pidiéndole, por favor, ¿verdad? Que hagan este programa. Nuestras familias cuentan con ustedes. Y en el final, quiero expresarles a la comunidad mi soporte a Inner Care, Grant Proposal to the Desert Health Care District. Este programa va a traer honestidad para los residentes del Valle de Coachella y nuestras comunidades merecen los recursos igual que las demás ciudades. Muchas gracias.
Desert Healthcare District, we need your help. Your own reports say we need more doctors here. This is your chance to make a real change. We are asking you, please fund this program. Our families are counting on you. In the end, I want to express the community support for InterCare's grant proposal to the Desert Healthcare District. This program is about bringing fairness for residents of the Coachella Valley. Our communities deserve the same care as everyone else. Please vote yes on InterCare's grant proposal. Thank you.
Thank you.
Thank you.
Thanks.
Nancy Del Castillo.
También voy a hablar en español.
Muy bien. I'm also going to speak in Spanish.
Hola, muy buenas tardes.
Hola.
Mi nombre es Nancy del Castillo. También trabajo para Unidas por Salud. Uno de mis trabajos que realizo yo en la clínica que tenemos, una vez al mes en Meca, en español, es la práctica que tenemos todo el tiempo con estudiantes de la universidad aprendiendo a hablar en español.
Hi, my name is Nancy Castillo, and I also belong to Unidas por Salud, the organization that puts on that one time a month free clinic in Mecca. And part of our role there is also to train medical students who come to serve our community by teaching them Spanish.
Las pláticas que tenemos con los estudiantes de medicina y con los doctores es hablar y entender la comunidad latina.
Part of the conversation that we have with these medical students and doctors is to understand the Latino culture.
Y todas las veces que yo he hablado con un estudiante de medicina y con un doctor y les pregunto que por qué quieren aprender español y no otro idioma, es porque ellos miran la grande necesidad que se encuentra en nuestra comunidad latina.
When I have these conversations with these medical students and doctors, and I ask them, why is it that you want to learn Spanish? They say that there is a huge need for Spanish-speaking providers in the community.
Y creo que todos nosotros, sin importar el color del que somos o la forma en que estamos vestidos o cómo hablamos, merecemos ser tratados como seres humanos y merecemos que sea en nuestro idioma, un idioma entendible donde no se pueda cometer un error por cuestiones de comunicación.
Yeah, it doesn't matter the color, how we're dressed, and how we look. We all need to be understood and be able to have conversations with a provider who understands us to reduce the risk of any kind of, miscommunication that could have, a severe outcome on the individual's health.
Sí, muchísimas gracias por haberme escuchado.
Thank you for listening to me.
Thank you.
Son Angel Cruz.
Solange.
Thank you.
Solange, ¿tú vas a hablar en francés o qué?
Yo voy a hablar español.
Ah,
Igual que mis compañeras. Ese es el propósito de nosotros, pedir doctores que hablen español y aquí estamos.
Perfecto.
Mi nombre es Sol Ángel Cruz, también soy de la comunidad de North Shore, igual manera que mis compañeras. A colaborar.
Sí, dame tantito, porque luego se me olvida. Hi, my name is Solange, and I'm also here representing, along with my colleagues, the communities of North Shore.
Trabajando con todo el equipo de Unidas por Salud.
I also work with the Unidas por Salud group.
Y en esta ocasión voy a ser la voz de las personas ya mayores. En este caso tengo a la señora Carolina, la señora Patty, la señora Dolores.
And in this instance, I am going to be the voice of older adults. In this case, I have with me Patty, Dolores, y la señora, ¿cómo se llama?
Carolina.
Carolina, and Carolina.
Quiero que miren la importancia que es para nuestra comunidad que las personas ya mayores tengan una atención médica excelente, se puede decir.
And I'm here to advocate so individuals, older adults, have the quality medical care that they deserve in their own language.
La importancia de detectar diabetes, hipertensión a tiempo, porque en nuestra comunidad es muy común estas enfermedades, día con día van en incremento.
It's very important for us to be knowledgeable about certain diseases such as diabetes, high blood pressure, and be able to address some of those issues in time because these diseases they're more and more common in our community on a daily basis.
Y que estas enfermedades sean detectadas a tiempo para una mejor vida, una calidad de vida mejor para estas personas, es muy importante para nosotros.
And for us, we're advocating for early detection and to have these services so we're able to catch the disease at an early stage and to limit some of the adverse reactions that could be brought on by such diseases.
Y al igual cuando asisten a una cita médica, el idioma principal es el español y muchas de las veces se les dificulta tener una consulta directa entre paciente y doctor, siempre y cuando, ¿verdad? Haya un intérprete, porque muchas de las veces no lo hay y para ellos se les dificulta tener una consulta con los doctores.
And it's very difficult to have a medical consultation with a provider that does not speak your language. It's very hard to share details. And in some cases, when we do have access to a translator is not available.
Y eso es muy importante para nosotros, que sean atendidos de la manera que ellos se requieren y la importancia también del idioma, como se lo he mencionado, ¿verdad? No nada más hablan español, muchas de las personas hablan purépecha y necesitamos doctores que atiendan, pero de una mejor calidad.
Yeah, we just need better quality doctors to be able to talk in Spanish and to be able to understand the needs of our community. So then we have better health outcomes because right now we're losing a lot in translation and we're not getting the quality medical care that we deserve.
Muchas gracias.
Thank you.
Maria Fozar.
Thank you all.
Buenas tardes.
Good afternoon.
Sesi churi kwarikecha yani nenga chusata. Ya kisasho wanda kinde kucha ireta na puchimbo pureche. Muy buenas tardes a todos los que se encuentran aquí. Hoy vamos a hablar para mi comunidad purépecha y mi comunidad hispana.
So good afternoon, everybody. Today we're going to be talking about my community, Purépecha, and my Spanish-speaking community.
Posiblemente no me habrá podido entender lo que yo dije en purépecha.
Possibly you didn't understand what I said in Purépecha.
Es la misma situación que nuestra comunidad hispana siente cuando entra el doctor que no habla español.
And it's the same reaction that our community gets when they walk into a consultation room, a medical room, and the doctor does not speak Spanish.
Estamos aquí el día de hoy para enfatizar y reforzar que la importancia de tener residentes médicos hablantes hispanos en nuestra comunidad.
I'm here to talk about and emphasize and highlight the need to have doctors that speak Spanish from our community.
Esto podría ayudar a mejorar nuestra salud, la salud de nuestras comunidades y tener la empatía entre el médico y el paciente.
This could help us increase not only the individual's health, but also the health of the community, and also have a little bit of empathy in the conversation between the patient and the provider.
Muchas veces tenemos que llamar a nuestras clínicas para hacer una cita, pero las citas no las dan en un mes o en 2 meses.
Most of the time when we call our local clinics to schedule an appointment, we get appointments, but we get them 1 to 2 months out.
Cuando acudimos a una clínica, máximo que nos atienden son 5 minutos junto con el traductor y uno no se puede comunicar a la perfección sobre los síntomas con tu doctor.
When we only have a 5-minute consultation, including the translation, it is very difficult to be able to relay what is happening with you to your medical provider.
Al tener residentes hispanos en nuestra comunidad, habría empatía para que puedan entender nuestra cultura, nuestras raíces y sobre todo que somos una comunidad agrícola con personas mayores y jóvenes que sería nuestro futuro.
By having doctors that speak Spanish, we're going to increase, we're going to have a little bit more empathy. We're going to have these providers understand our culture, understand our roots, and be able to communicate with us in a very effective manner, and also improve the health of not only adults, but older adults, and also the youth who are our future.
Posiblemente los datos nos demuestran que en nuestra comunidad del este del valle tenemos un gran alto de diabetes, colesterol, obesidad infantil. ¿Pero a qué se debe eso?
So the data is going to reflect that in our communities in the eastern part of the Coachella Valley, we have a high incidence rate of diabetes, high blood pressure, childhood obesity.
Es por la falta de empatía entre el médico y el paciente y que puedan entender la receta médica en español y la explicación que se debe saber.
So this is due to the lack of empathy between within the medical providers that do not understand the culture and are not able to really relay the information in a cultural manner for us to understand it and take action.
Hikshu ya sa shukura marishaka chanchnano. Distrito de Salud del Desierto. Eshkatsan halang ariak, kasantran in de pamo juntaka, para kan huchawa kiman sinah pitichan hatsian en gaksturi wanda. Este día le digo al Distrito de Salud del Desierto que tenga un poco más de empatía en nuestra comunidad hispana y que pueda aceptar y aprobar que los residentes médicos hablantes español lleguen a nuestra comunidad. Muchas gracias.
Today, I tell you, Desert Healthcare District, to have a little bit of empathy and accept this grant proposal put forth by Intercare so we can have more Spanish-speaking doctors in our community.
Gracias por la traducción. Gracias.
Jay Reyes Lopez.
Good afternoon, all members. My name is Reyes Lopez. I've been community organizer with ICUC and Congregation United for Change for over 7 years. Serving the Coachella Valley, working alongside some of the most underserved, forgotten, and marginalized communities in the region. Over the years, I have heard stories that have moved me deeply. People who have gone decades without basic medical care. Women who have never had a mammograph or pap smear. Men and women missing teeth because they simply can't afford dental care, and often beyond the lack of resources. It's fear, shame, and cultural barriers that keeping them from the seeking help. I translate.
Yes, thank you.
That's why I'm here today, asking for your support. to the members of this board. To all those who care about equity and dignity, please consider approving and support InnoCare grant. Every dollar makes difference. Every contribution brings us closer to provide essential life-saving care to the people who need. Thank you for listening. Thank you for your belief and community. And thank you truly for stand with us. Hola, mi nombre es Reyes López, organizador comunitario por ICUC en Coachella Valley, trabajando en el Valle por casi 7 años con las comunidades más pobres, olvidadas y marginadas de esta región. Durante todo este tiempo he escuchado historias que me han marcado profundamente, personas que han vivido décadas sin acceso a atención médica básica, mujeres que jamás han podido realizar una mamografía o un papá Nicolau, hombres y mujeres con piezas dentales perdidas simplemente por no pagar un cuidado esencial. Y muchas veces más allá, la falta de recursos, lo que impide que busquen ayuda es el miedo, la vergüenza y las barreras culturales. Por eso estoy aquí. Vengo a pedir su apoyo. A ustedes, líderes comprometidos, le pedimos que consideren seriamente en aprobar el InnoCare Grant que viene. Cada dólar que donen, cada dólar que ustedes aprueban, transforma acceso, cuidado, dignidad y vida para cientos de personas que por mucho tiempo han sido olvidadas. The immigration policies is hard today. Please support this initiative. Thank you very much.
Hi, Madam President. I have something really quickly. Can we check in on Arthur, our Director Shore? Are you with us?
Trying to call him.
Are there any more online comments?
There are, yes. Carmela, you have the floor.
Hello, everybody. I know I have spoken to this group a couple of times before. But I wanted to speak today not about the need. You've had a number of individuals that have so eloquently talked about the need in the community in a much better way and much more eloquently than I ever could. What I'd like to talk to you about today is my experience in developing new programs, what I've seen and what I am seeing across the country. Number one, the amount of outpouring of support for this program is amazing and really should be praised. It is not often that as I build programs across the country that I get or I see this level of outpouring. So it is amazing to watch. I can tell you that I've been in medical education for 30 years. I've been standing up programs from Florida to California, and it is never easy. I get that. However, it is never without reward. And the reward is that the individuals and the people in your community get the health care that they so desperately need, as eloquently said. So one of the things that we have done, Dr. Barzaga has done an amazing job of taking due diligence to making sure that this program can sustain itself. And where this comes into play is the feasibility study. The feasibility study looked into the patient population, which is available at the ACGME required levels. There is no concern there. The other area is in regards to the types of experiences. And because the need is so high in the area, the experiences that these residents will have will be ACGME sufficient, but more than that, it will be the state of the art education. They will be so well received within the community. Not only that, is they become role models for the youngsters in your community to go into the health sciences and health professions, which is what we want to see. And the last thing I would like to say is, as I have worked with the ACGME and standing up many programs, I can tell you that while in the past academic programs surpassed community-based programs, that is no longer the case. Community-based programs number well more than the academic programs, and that is because they are in the communities that need the healthcare most desperately.
Thank you, Carmela, for your comment. Amy Kewen, let's unmute you.
So Carmela, brevemente lo que ella expresó de que ella tiene mucha experiencia desarrollando este tipo de programas que está proponiendo InnerCare desarrollar aquí en el Valle de Coachella, y no solamente que tiene experiencia desarrollando, pero también implementándolos, y que a través de la nación, pero también que ella no va a hablar mucho de la necesidad, porque muchas de las personas aquí que hablaron con tanta elocuencia sobre la necesidad que hay en la comunidad, pero ella también quiere expresar que esos doctores no solamente van a servir a nuestra comunidad latina hablando español, pero también van a ser ejemplos para nuestros jóvenes, que también los motiven para entrar a las ramas de las ciencias de salud, para que puedan ser nuestros futuros doctores, futuros enfermeras, que se puedan quedar aquí en el Valle de Coachella apoyando a nuestros residentes.
Go ahead, Amy, you have the floor.
Hi, everybody. Good afternoon. My name is Amy Quinn McDuffie. I'm representing Supervisor V. Manuel Perez. I just want to express my support for this program that InnerCare is presenting as a potential grant, and say that Supervisor Perez is very passionate about extending access to healthcare in the Eastern Coachella Valley, and this would do just that. So we look forward to continuing to express our support at the next meetings. Thank you.
Thank you.
Thank you. Bien, ahorita que habló con nosotros fue Amy Cuen, que trabaja por a la oficina de nuestro supervisor V. Manuel Pérez. Ella pues obviamente dice que el supervisor está muy apasionado a ampliar el acceso a la atención médica y asegurarnos de informar al Valle sobre este tema. Esperamos seguir expresando nuestro apoyo a la próxima semana para que esta propuesta siga y se implemente para ayudar a nuestra comunidad. Ya utilicé una aplicación que me está ayudando. I'm using an app now.
I think unless we have any other comments, I think we can move on, President.
No other comments?
I want to make a comment. Of course. I just want to say, voy a decirlo en español, que le quiero dar las gracias a todas las personas que asistieron hoy, esperando que este tema se iba a comenzar. Y disculpe que no se pudo comenzar oficial, pero siquiera sí tuvieron la oportunidad de expresar sus pensamientos y su apoyo de esta aplicación. Y espero de que cuando continuamos esta conversación, que ustedes siguen tomando en cuenta, informándose y apoyando, porque como dijeron ustedes que tenemos que tomar en cuenta sus necesidades y ustedes son las mejores personas que pueden darnos esas opiniones. Pues muchas gracias por tomar su tiempo y gracias por entendiendo que esto es un proceso y aquí los espero en el futuro. I just want to say that thank them for attending, that giving them the opportunity to speak. I know that it was important for them to participate. They started the process, and that I hope that they'll continue to participate.
So can I echo that? I actually understood most of that, lady, so thank you. Is that that was my whole reason for not completely pulling this. And I thank God we left this open for public comments, because this is a crucial issue for not just the Eastern Coachella Valley, but the entire Coachella Valley. And I applaud all of you who showed up tonight and gave your comments. And this is a worthwhile program. We have some issues to work out, obviously, but I will tell you, in all my research and my work in the FQHC world over the last 10 years, is that this is the best opportunity we have to increase access to healthcare in the Coachella Valley. So again, thank you all very much for expressing your comments.
So, el vicepresidente de la mesa directiva, Greg Rodríguez, le quiere dar las gracias a todos ustedes por estar aquí y por brindar sus comentarios. Dice el vicepresidente de la mesa directiva que esta es nuestra mejor oportunidad para incrementar el número de los doctores que hablan español aquí en el Valle de Coachella. So, la conversación sigue y él dice gracias por estar aquí y que va a seguir la conversación con el apoyo de cada uno de ustedes.
Gracias. With no other comments?
One more comment.
Okay.
I just want to mention, más quiero mencionar que una cosa que oí varias veces es el lenguaje de saber español, pero más importante es que los residentes entiendan la cultura. Okay, eso es tan importante. The one thing I just mentioned, I just picked up from all the speakers about the need to speak, for the residents to speak Spanish, but I think even more important is understanding the culture. So, thank you. Gracias.
And I would like to see at a future meeting that we have a Spanish translator. Not saying that our esteemed.
Especially now that he has an app.
Yeah, but I think it's not in his job description.
It's all right.
He said a very good job.
But he does a good job. Okay, on to the agenda.
I do one more public comment. Is it too late?
Sorry?
Too late for one more public comment?
Sure, as long as President Rogers is okay with that.
Sure.
I just wanted to advance something from my.
Please come to the
Yeah.
Okay.
I just wanted to advance something from the president report for Desert Regional Medical Center. My name is Mike DeToro, the CEO of Desert Regional Medical Center. And before we lose potentially some of our guests here, I wanted to make the comment and dispel some rumors that have been online. We do not have ICE or Border Patrol coming to the facility and arresting patients. There has been a lot of chatter online. It is not true. There have been Border Patrol trucks on campus that actually bring us patients for care. But in no way have we had any patients that have been arrested from the hospital. And I just wanted to make that comment before we possibly lose some folks.
Appreciate that.
I'll second that too. The other hospital in town has had no issue with that at all. I would connect that story. So you want to communicate?
Sí, so ahorita Mike Toro, que es el director ejecutivo del Hospital de Desert Regional, que está en Palm Springs, quiere difundir algunos rumores que han circulado en las redes sociales que no han tenido la patrulla fronteriza viniendo a las instalaciones a arrestar a los pacientes. Se ha hablado mucho en internet sobre eso. No es cierto. Ha habido camiones de patrulla fronteriza en nuestra área que nos traen pacientes para atención médica, pero no están entrando al hospital ni tampoco al otro hospital de Eisenhower para arrestar a personas que están buscando a la patrulla fronteriza o ICE. So es todo lo que quería mencionar. Y también el hospital de JFK, o los tres hospitales aquí principales, quieren hacer ese comentario que no están dejando entrar la patrulla fronteriza ni a ICE o darles el acceso para que entren a arrestar personas. Si miran patrullas en esas tres ubicaciones, es porque están llevando pacientes o a personas que necesitan atención médica para que los ayuden en esos tres hospitales.
Sí.
Gracias.
De nada.
So, thank you all for coming. If you'd like to stay for the rest of the very interesting meeting, please feel free to do so. Next, we have consent agenda.
I'll move approval of the consent items.
Here, second.
Second that.
Director Perezio,
Yes.
Treasurer Rata, Secretary Baraza, we're approving the, we'll come back. Director Delara?
Yes.
Yes. That was a yes, Secretary Baraza?
Yes.
Okay, Director Logston?
Yes.
Director Shore?
Yes.
Vice President Rodriguez?
Yes.
And President Rogers?
Yes.
I think they were waiting for your vote.
I said yes.
No, everyone voted. We were just waiting a minute to, get the phone. Everyone can see.
Okay, next on the agenda is strategic grant funding, which are action items. Number one, grant number 1499, Clínicas de Salud del Pueblo.
That's.
I'm sorry. I know, thank you. Grant number 1511, Visión y Compromiso. Expanded access to mental health services for children and families in the Coachella Valley for $193,145. Is there a staff report?
I have a staff report in your packet and program committee recommended approval. It's going forward to the board for approval.
Is there any discussion?
I move approval.
I'll second.
Do you have representatives?
Any comments from the public? Roll call, please.
Director Perez Hill?
Yes.
Secretary Baraza?
Yes.
Director Delara?
Yes.
Director Logston?
Yes.
Director Shore?
Yes.
Vice President Rodriguez?
Yes.
President Rogers?
Yes. Next is grant 1519, Alianza Nacional de Campesinas, Coachella Valley Food Distribution for $75,000. Is there any staff discussion?
Program committee recommended be approved. To be forwarded to the board for final.
I'd like to move approval with just a couple comments. I think this is a good follow-up on the meeting that they attended with Fine Food Bank and the partnership that they will have. And I think especially with the proposed pretty much set in stone reduction to SNAP food benefits, that this is a great initiative for us to get ourselves involved in. So I would move approval.
Second.
So moved.
Any board comments? Any public comments?
No, I don't see any public comments.
Roll call, please.
Director Perez Hill?
Yes.
Secretary Baraza?
Yes.
Director Delara?
Yes.
Director Logston?
Yes.
Director Shore?
Yes.
Vice President Rodriguez?
Yes.
And President Rogers?
Yes. Next is request for proposal, empowering resilient youth and families, advancing mental and behavioral health support. $1 million allocation over 2 years. I understand this is an initiative that was brought forward.
Yeah.
Is there any comments?
Sorry, we're looking at each other. So staff has done a lot of work around this topic. There's history to it that goes back to relationship possibly with RAP Foundation, but we have continued to develop this item through data walks, and we feel it's very important at this point to ask the directors for support in producing a request for proposal and allocating $1 million towards this opportunity to support this effort with the empowering resilient youth and families by advancing mental and behavioral health.
Any more comments? Director Delara?
So I am in favor of this. The only part I'm not in favor of is the fact that it's only 500,000 for year one and 500,000 for year two. With 62 individuals participating in the data walk and 40 organizations across the region, I'm just wondering, why did you settle on 500,000 instead of a higher amount?
It's $1 million for 2 years.
Okay, so it's 1 million?
It's
Okay,
been for 2
okay, so I,
For 2 years.
so it said, 1-year term and amount of 500,000, so. And,
The grant would be approved based on 2 years, so, and it's not to exceed 250,000
Per,
per.
so year one is how much? Year one is how much?
If it's together, so we're not asking for 2 7-year budgets, we're asking for a 2-year budget.
How much are you making available for year one?
How much are you making available for the total RFP?
$1 million.
1 million for a 2-year project.
2-year period, yes.
Okay, so why settle on 1 million? Was there a reasoning? I just think that the demand is going to be higher than, this, you already have strategies.
We're developing the strategies
You're
now.
developing strategies. I'm just,
Anticipating the RFP to be released next month.
how much was the last RFP that you did? $1 million also, so
Mitigating, and then the social isolation one, same thing, you know.
1 million. It just seems like it's just a small amount. Okay, is it okay if you, after you do the RFP and if you come back, that if staff feels that we should revisit that dollar amount? We could do that, because I just think that you're gonna get a tremendous response for that art, for applicants. And if you see that a lot of those are ones that we need to consider, there's a lot of work that goes into an RFP, and I just wouldn't want it to be that you limit it to a dollar amount, that you have to go through this whole exercise again, when we could just fund more that are actually addressing the strategies.
Right, when we did the very first RFP for the building, for behavioral health, this is what this was based on, because the impact and the results that came out of that one, it was like 2-3 years ago. We actually had grants that came in that we wanted to approve, and it was over 1 million, it was like 1.2 million, so we came back to the board and it was increased.
It's a good method for doing that. To come back with an additional increase request. Easy way to handle it.
right, so we can evaluate that once the proposals come in and
I'll move approval.
That's a great.
Great. Is there
I'll second.
second? Any more board comments? Any comments from the public?
No public comment. Director Perez Teo,
Yes.
Secretary Baraza,
Yes.
Director Valaro,
Yes,
Director Logston,
Yes.
Director Shore,
Yes.
Vice President Rodriguez,
Yes.
and President Rogers.
Yes. Thank you. On to reports. Number 1, Desert Region Medical Center CEO report. Mr. DeToro.
okay, we'll see.
long time. Thank you for letting me advance that one part of my report. I thought it was
Glad you
important for
did that.
everybody to hear it. Couple updates on our people. We started 29 new residents this year. A lot of talk about residents tonight. Our internal medicine program also reopened. We have 6 residents that started, all in July. This year, from a recruitment and retention efforts at the hospital, it's been a very successful year. We brought in, year to date, we've hired 134 new employees, 76 which are nurses. We're well outpacing our folks that have been terminated from the system, so we're doing very well on recruitment. Couple service events and things to update on. We did move forward with adding weapons detection systems in front of the main hospital and the main entrance and in front of the emergency department as an effort to keep our folks safe at the facility. We've had some good positive response from the folks since we've had it in there. On July 10th, we really got to see our trauma team in action as they heroically, as they always do, stepped up and responded to that big accident on the 10th, a tragic accident. We had 6 patients that came into us that were life flighted in there and brought in, and really some amazing life-saving care that the team does. And to see the folks in all the different surgical specialties in the emergency department ready to step up and care for the patients is really a sight to behold. And the other thing to celebrate, and we did get a little bit of media attention on it on July 12th, so a couple Saturdays ago, we had a young mom, 31 years old, who came in preterm, 31-week kiddos, who was bleeding, had to be acutely brought back, and we safely delivered triplets. Our first set of triplets in over 5 years. She just happened to be a patient of Dr. Abdullah. So a nice story there. And she was quite happy that they're from Yucca. They could get the care they needed closer to home, not having to go out to Loma Linda for her to come in every day to see her little ones, Harrison, Hudson, and Addison. And she and her mother were both born at Desert Regional, as was her first son, Grayson. So just a really nice story. And that first set of triplets in over 5 years, which is really nice. And they're still.
Status of your NICU there, how's it doing?
Great. Good. Yeah, it's doing great.
How busy is
Those 3 little ones are growing as they need to.
Yeah, and how busy is it right now?
It's busy. We have over 20
filled
today.
You have to send out because they're too full. There's no other NICU. You're it for the valley.
We're it. We have transport teams that go out and pick up kids from a lot of other facilities. So we haven't been at capacity.
Oh, that's good. That's
in a few years, but yeah, we've got 31 beds.
And neonatologists on staff too.
Oh yeah, 24/7 in house too.
Great.
Yeah. So then I covered the social media piece and then just a couple updates on projects. We are moved on to the last OR for our OR renovations. So the last one on the 9 starts on Friday. Our elevators are underway. And Letty, you had asked for an update on JFK. Our architects have advanced a new concept for the JFK or the ED at JFK that will allow it to be built a little faster. So they're working through all their plans right now, which takes time to get done, but those things are in development.
Thank you for remembering.
You're welcome. And that's it.
I had a question for you.
Sure.
On the 29 new residents.
Yes.
Do you know how many speak Spanish?
I don't know how many. I do know that some do, but I don't have that number off the top of my head.
Is that an ACGME question when is posed to residents when they apply? If they speak Spanish, is that under consideration?
No, not for that decision. But it's asked if you speak language, if you're bilingual.
I see.
For sure.
All right, go ahead.
With that question, do you know how many of them are from the area?
I know we've got a few, and I've met all of them. We've got a few that are from SoCal, right from the Valley. I don't think we have any. I know we've got one or two from South America. We've got a pretty big geographic spread on them, but there's a good group from SoCal. So
Maybe explain the match. Mike, maybe explain the match. We can't choose through the match process.
yeah, so the way it works to get into a residency program, you interview a whole slew of candidates that come in. And then let's say you've got 10 slots and you have 30 candidates that come in. We actually go through the matches outside of GME and we rank all 30 candidates 1 to 30. And then the candidates will rank all the different facilities that they go, 1 to how many. Dr. Logsdon can fact check me as I get this. And then the system spits out and aligns, if you've got a 1 and a 1, you match that person. And then it's got its methodology, how it goes down further on how you match it. So you can't just pick so-and-so because you go through the match. There is an off-match process, which if candidates don't get selected and then a program has open slots, then we could directly say we're going to hire this person if we wanted to. But through the match, we don't have that choice. Thanks for calling out.
Any other questions? Any comments from the public?
I have one question though. Are you having permitting issues with JFK?
Permitting?
Getting your permits approved to expand hospital, anything like that?
Yeah.
We're not, you mean city or HCI?
All of it.
Because we're not at the permit phase yet at city, and that's a pretty easy one for us. HCI, of course, takes time, but it's not active at this point because we had to update code.
Right.
I'm just curious, when you get to that part, it's a good time to involve community leaders because the HCIs can take forever. Not many people.
And not once we all start getting on the seismic train.
What you hear here, right? So what you heard here is everybody's waiting for care. You're trying to meet that. The state wants you to meet it, yet the state's going to limit your ability to do it through HCI. So I think that's going to be a really important point that you bring back to the board, get to that, because there's a lot of support here. We saw it today. Use that to help move that through because we do need JFK, all those things you're doing, the community needs it. That's the closest hospital to everybody that was here tonight.
That's it. Thank you.
Go ahead.
And I hope the changes that you're making to the plans are not gonna be reducing space or reducing.
They're not.
services.
No,
Okay.
no, we need more space. It's not big enough.
Right.
It's a better design. There would be less spaces. I can't give you all the details on it. Just,
I'll take your word.
and from an engineering perspective, it makes a lot more sense.
Okay, thank you.
Director Shore has the comment.
Thank you. Yeah, I don't want to return the discussion back to Intercare, but I just want to put my colleagues on notice that the matching issue is an issue that I think in our workshop we need to take up. There's some serious ramifications to the matching program for new residents and stuff that I think will impact our ability to recruit, and I'll reserve my comments for the workshop, but I just wanted to put everybody on notice that I have a fairly serious concern here. Thank you.
Thank you. Any other comments?
Right.
I do. Mike, I appreciate the attempt for an expedited process. I think especially in light of the issues with the Palo Verde Hospital, with JFK being the most, the closest hospital. So thank you.
Yes, thank you.
Go ahead.
Speaking of, thank you, Greg. I was gonna bring it up at board comments, but since you brought it up now, what is the impact of the reduction of services at Palo Verde Hospital on JFK?
We've had a lot of transfers that have come to JFK and to Desert, and we've got a lot of transfers over the years from Palo Verde anyway. We have seen an increase. Linda and the team have met with them and fully we are supporting. We've reached out, and do you have the numbers of how many additional transfers that we've taken over from them? I mean,
I don't have specific.
It's a healthy number.
County's tracking them as well. We're reporting into the county, all the hospitals, and making sure that we can accommodate those. Similar to what happened during COVID with the Imperial County, we were getting an influx. So we need to make sure we have capacity for our own residents. So that has been manageable, but we're part of the work groups, and Greg can attest to that, and trying to look at solutions and advocate for whatever assistance is needed, even potentially hiring folks that have been displaced.
Yeah, and Linda, I want to thank you and Tenant because you have been extremely involved in this and have been at the forefront of finding solutions. So thank you.
Team effort.
Great. Thank you, Mike.
Well, if we're talking about the numbers, that as Linda mentioned, the county is going to work on a dashboard. I don't know, Amy, do you have any insight on that at this point or not?
Yes, so I spoke to our RUHS team. They seem to think it's a fairly simple process, so EMD is currently working on that. I don't have a timeline for when that will be live, but I will try to get that answer.
Thank you.
Next, Desert District CEO report, Chris. You're on.
Okay, some of this discussion has led right into this topic. So it's regarding the Palo Verde hospital situation and the healthcare district situation, Palo Verde. And just an update, we have established an ad hoc committee, and we have been working with stakeholders with that initial meeting. And thank you, Amy, for communicating that update on the work around the dashboard. And we have also along the way, the healthcare district, Palo Verde Healthcare District on the 16th, they voted to approve a resolution to file Chapter 9 bankruptcy. Now, my understanding with that is not being implemented yet, but it's just approving that resolution if they choose to go that route. LAFCO has initiated their MSR, or their municipal service review, that they plan on expediting, which I don't know how quickly the expedition of that program will take. Hopefully by September or October. But I do know they're dark in August as far as meetings, et cetera. So don't know how soon that process will take place. They do have an agenda item on their this coming Thursday's commission meeting. However, it's more information only, that they're talking more about the MSR process and that they anticipate having that back by the end of September. Also, the district had sent a letter to Gary Thompson, the executive director at LAFCO, and asked him to engage with how the pros and cons of what would happen if the Palo Verde Healthcare District were to ultimately be dissolved, merged, or if there's support to continue the healthcare district. And he had responded to me, and I forwarded that message to the directors. But essentially, he's happy to hear from us that we do have interest in what's happening with our neighboring healthcare district. And he was expecting some materials back from the healthcare district in their process with the MSR. And I look forward to hearing back from him sometime in the next few days to learn what they're doing and also develop the relationship with our healthcare district and how we can work to support. And also just an update from Senator Padilla's office that they were able to get some approval on funding support for the hospital, for Palo Verde Hospital. I was concerned or asked the question what the funding was, and the response was that it's not, the $4 million that was requested was not approved yet. However, what was approved was an extension on the loan repayments of the existing loans. So my understanding is they have $8 million loans that they have outstanding. And so they're extending that loan repayment, which they're hoping will help support the financial situation at the healthcare district. Not optimistic of that, but that's the communication that we've received so far.
Thank you. Comments? Julia?
So thank you for sending those links for those meetings. They have been very informative. I've attended, I think, all of them.
Right.
There's so much information there, and I think at some point there will be a need for the full board to be aware of what's going on, the history and the possibilities, and the asks that might come. So I know that you'll take the action that you need to take at the appropriate time to maybe put it either as a workshop or as a agenda item. But yeah, there is a lot to it there. And you shouldn't rely just on rumors. You really need to go with facts. And that's what I think I have gained a lot from attending these meetings is just the factual. I know that I got emails from people saying, oh, did you know the hospital is closed as of just 2 days ago? So it's just I'm glad that you have now connected us to be able to get the information direct and that you have a contact with NAPCO. So I appreciate that. So thank you.
Thank you.
Any other board comments? Any comments from the public? Okay, continue.
Next item, B, there is diversity, equity, inclusion, and governance workshops. So there's just a staff report there that's letting the board know that staff would like to bring both of these options back to the September board meeting with proposals for the board to consider for us to do some workshop work regarding the DEI and also governance.
And also it's doing this meets the requirements for our ACHD accreditation?
Yeah, that good point. So if you recall, we have done board self-assessment work that has been through ACHD and working with Larry Walker, who we worked with before on some governance workshops. And that actual form, although it's supportive of what we need to complete in order to satisfy the requirements for our certification with ACHD and CSDA, it doesn't always necessarily apply to our healthcare district that is more of a community healthcare district and grant funder. It has a lot of hospital operation kinds of things in it. So what we were able to do is get approved by ACHD to allow our workshops to comply with the assessment. So that would meet the needs for the board self-assessment. So thank you, Director.
Any comments? On to number C.
Number C is the standing committees. We've done a little work in changing some of the times around. So you'll see with that the highlighted meetings that we're changing times with. So we have the program committee that will be moving from noon on the second Thursday to 3 o'clock, I believe, or did we do 4? Yeah, 3 o'clock on the second Thursday, and then the quarterly policies meeting will be at noon on Thursday. So those are essentially kind of shifting times. However, the policies committee is quarterly, and then our program committee is monthly. And then we're shifting the legislative committee from the second Tuesday in the morning to the second Wednesday at 3 p.m. So all the directors that are on those committees had acknowledged that they would be acceptable to making those changes. So we're just making this an information item on tonight's agenda.
Thank you. Any comments? Okay, on to D.
Item D, the report is in there for CEO engagements and the district media visibility, if there's any questions.
And E.
Okay, item E has been a lot of work that has been developing over time, and the board has interviewed some of the strategic planning consultant firms that will guide us through our strategic planning processes. And we have narrowed down to 2 finalists. One is Activate Inclusion. The other is SOAN Strategic Consultants. And those are before you this evening. We have included a summary, and one update to the summary that failed to change is that we had printed in there that it was 2 to 3 community meetings. However, based on the director's request at our last meeting, there was a request to add items up to 7 community meetings that would include all 7 of our zones. And then also, how would the consultant incorporate equity into the strategic planning process as well as the strategic plan? So those items were provided and were updated in the proposals, and all that information is there before you and for you to consider in this process of decision.
Thank you.
And we do have representatives from both of the organizations that are online with us today. If there's any questions that they can help us answer.
Open it up to staff discussion. Board member discussion. Greg? You had your hand up, Director Rodriguez.
Yeah, I want to first of all thank staff for the incredible amount of work that they've done on this. And I would move to approve the contract with Soen.
I would second that motion.
Any more discussion?
In addition to thanking staff for all the work that you did, I want to thank the two applicants. I think that they both did a good job in presenting to us and addressing the questions that we had. And I'm supportive of either one of them, but I like the price on the other one. So I'm gonna support the motion that is.
I don't have a lot of experience working with consulting groups. Can somebody share what they like about Soen versus the other? You know, Greg, whoever's like, I'd like to hear your opinion on that because I don't honestly have one because I haven't worked with these guys a lot, consultants a lot.
I've worked with a lot of consultants, Dan. So, yeah, again, a lot of kudos goes to the staff on research. But Director Barraza brought up a point in our last meeting about the way that the presentation was presented shows a really good example of what will be presented to the public, not only in the information, but also in the graphics and the design. I will say too that and I've literally have just recently been dealing with Amazon World Service consultants and Slalom on data lake systems for the county, and that what I felt with Soen was a real buy-in and a real just an enthusiasm for where we're going. And I think that's really, really important when we're embarking on such a big initiative like this. And that was really what put my feelings over the top with them.
Director Shore?
I would support that, and I would suggest two things, a couple of additional dimensions of that. There was a certain degree of passion that wasn't present in the other group. The other group was more compartmentalized, and it didn't have a continuity. And when we stressed the question of creativity, you could see that there was a responsiveness to it. There was a reaction to it as if to say, we understand that you're looking for creativity. We understand that you're looking beyond necessarily the mechanics of just consulting and producing a document. And that combination of passion and respect for integration of what they were doing and their openness to thinking outside the box was what pushed me over the edge.
Thank you. Any other discussion?
Just that either one of these two would have done a good job.
Exactly.
But the only thing that made me go with this one is that it's a better price and we are accountable to the public, and I think they can do the job just as well. So that's.
I agree. Any discussion from the public?
Public comment.
May we have roll call?
Director Perezio? Yes. Secretary Barraza?
Yes.
Director Delara?
Yes.
Director Logston?
Yes.
Director Shore?
Yes.
Vice President Rodriguez?
Yes.
And President Rock?
Yes.
And from the staff's perspective, I think both organizations, your professionalism, your ability to work together with staff and the board, and your quality proposals and being responsive to any of the questions and the requests that were made. I thank you both and appreciate all that you've done along the way with it. So thank you.
Great. Okay. Item F.
Item F is a letter of support for AB 1400 that's sponsored by, I forget if this is Assembly Or not, Surya. It's regarding California Community College Bachelor's Degree in Nursing Pilot Program. It's presented to you for your consideration of support to send this letter forward.
I enthusiastically support that, so I will make a motion to send.
I'll second. Nurse Carol gets to second it.
You make the motion.
I think it's up to members of the board to make motions. Go ahead.
It's great. I had one question in the letter. It says that BSN programs have more than doubled, often charging tuition well above $100,000. Do we have those facts?
I don't think we have them personally, but it's whoever's written the letter who either trust that or we can ask for it.
The legislature is now.
I know, but we're signing it.
I could see it happening if you go to a
I'm just
private.
curious. I mean, I just was curious if we have done any, I actually kind of believe it, but you know, if we're quoting numbers in here, signing our organization's institution to it, like I would like to know where they pull the facts from because people are very good about making up facts. You know, it's very believable. We know there's a shortage. I'm trusting their shortage numbers, but I don't have access to necessarily like how many nurses were short in the public health sector on a statewide, but that sounds about right. But $100,000 seems expensive, but maybe. So I don't know. I'm fine with the letter. I like what it says. It's pointing that, yes, we need it. I just always question when there's numbers quoted without data. So
yeah, I can't attest to the numbers, just trusting the sources.
Maybe we just take out the number unless you have a way to validate it.
So maybe we can approve the letter pending.
Hold it. Madam
Go
Chair,
ahead, Arthur. Yeah, you may know.
I just had the privilege of attending two grandchildren's respective graduations from Tufts and Northwestern, and my youngest grandson from high school. And I can assure you that even though I don't have national statistics, that number is very consistent with undergraduate education today in the United States.
Thank you. Any more comments? This is an action item. Any comments from the public?
No public comments.
Roll call, please.
Director Perez-Gill,
Yes.
Secretary Baraza,
Yes.
Director Delara.
Yes.
Director Logston.
Yes.
Director Shore,
Yes.
Vice President Rodriguez,
Yes.
and President Rogers.
Yes. On to G, sponsorships.
Okay, we have 3 sponsorship items. The first one is for the Mizell Center Senior Center Benefit Concert, $5,000 supporting sponsor that will go to Mizell for this event, but supporting their efforts in their.
Any comments? Any public comments?
Move approval.
I'll second it.
Second.
Right, no more comments. Roll call, please.
Director Perez-Gill,
Yes.
Secretary Baraza,
Yes.
Director Delara,
Yes.
Director Logston.
Yes.
Director Shore,
Yes.
Vice President Rodriguez.
Yes.
President Rogers.
Yeah. Number 2.
The next agenda item is Riverside County Medical Association's annual Caring for our future medical scholarship fundraiser. $1,500 silver sponsorship to assist with the venue rental of their event budget.
Any comments? You have a motion?
I'll make a motion to approve.
Second.
Me? Any public comments?
None.
Roll call, please.
Director Perez-Gill,
Yes.
Secretary Baraza,
Yes.
Director Delara,
Yes.
Director Logston,
Yes.
Director Shore,
Yes.
Vice President Rodriguez. Vice President Rodriguez
Yes.
and President Rogers.
Yes. Number 3,
And the third sponsorship request is a $2,500 bronze sponsor for ABC Recovery Center for their A Beacon of Courage Gala.
go ahead.
How much did we give them last year?
I believe it's the same amount.
Same amount,
last
500? Okay.
Any other comments? May I have a motion?
So moved.
A second.
Public comments?
No public comment.
Roll call, please.
Director Breckiel,
Yes.
Secretary Baraza,
Yes.
Director Delara.
Yes.
Director Logston.
Yes.
Director Shore,
Yes.
Vice President Rodriguez,
Yes.
and President Rogers.
Yes. Okay, under reports, legal counsel?
Yeah, thanks to Director Logston for bringing SB 707 to my attention. In essence, the bill attempts to modernize the Brown Act in improving transparency and expanding public access to public meetings, primarily or particularly for disabled people, working people, and non-English speaking communities. So it's at this point, it's passed the Assembly Local Government Committee last week and has been referred to Appropriations Committee. It pretty much leaves the meetings related to remote board meetings for the board members for our regular meetings. It pretty much leaves those rules in place for the district board meetings. But it does loosen some requirements for board members attending standing committees. So I'm kind of interested to see how this develops and gets through. So there might be a little hope there for some flexibility. The bill also requires the posting of the agenda in what it's called the applicable language, which is if you got a population of 20%. So as a practical matter for us, it would obviously be Spanish, and it does allow for kind of like what we saw tonight. It's not required that you have interpreters at the district board meetings, but it's certainly encouraged. And so I think we're going to see more and more of that. But to be honest with you, I got to study it a little bit more and see how its final version shakes out. But I think it's well on its way. And it should be kind of interesting. I do appreciate the idea that somebody has attempted to kind of look at the history of the Brown Act for the last 30, 40 years and kind of update and modernize it in light of remote meetings and telecommunications and things like that. So it's pretty thoughtful. So I look forward to kind of looking at it a little more closely.
Thank you.
Yeah, I have a comment. Kimberly, is this something that our legislative committee and our representatives in Sacramento, our lobbyists would be willing to support if we got it a little closer, made any recommendations if there's something in there that we'd like to see changed? Because I like the flexibility of what this mentioned, at least the high level when I read through it, in terms of modernizing what we're talking about, telehealth community or telecommunications. So is that something you're interested in taking up in that committee?
We can, where we are in the cycle, we can submit comment or suggestions, but they wouldn't be able to be added. So it'd be very difficult to add amendments to the bill this far out. But yeah, I think, we can look into it a little bit more. And if you do have suggestions, if you want to communicate that with the committee,
Is this,
Maybe have our lobbying firm take a closer look at it, get their opinion on it as well.
I think what Kimberly's saying is that, you know, it's getting a little late in the legislative process to make any big amendments to it. But we really it really would be helpful to work with our district legislative committee and make sure that they're updated and given a status of where the board is going. Cause you know, who knows at this point of the year, you know, things get waylaid, but it'd be kind of curious to see what happens with it. So
We can put
that's where I would work with the committee.
so can we get our lobbyists to give us like the most up-to-date information on this?
Yeah.
'Cause it does provide the flexibility, especially for committee meetings. This is a 100% no-brainer.
Yeah, no, I thought that was pretty significant. I mean, that
It's
was.
the whole reason we just had an update on why we moved our committee meetings. It's because of other people's work commitments.
Well, and you know, we want to follow the rules but this is kind of refreshing that somebody's taken the time and been thoughtful about
Coming into the 21st century, basically.
Well, and you know, the other portion of it was there was a recognition that, you know, elected officials, sometimes you can be disabled and be an elected official. And this bill addresses that, and I think that's positive, and so we'll see. But I do think there's some good aspects to it, and it combines these other bills that are sort of trying to extend the dates for some of the flexibility with remote meetings and things.
So I mean, to Kimberly's point, we can't do any amendments at this point unless it became a 2-year bill, which it doesn't sound like it's going to be. So it would be good, Chris, if we could get the lobbyists to give us their take on where it's at, what the specifics are. And if it's amenable to us, you know, and I'll defer to you, Kimberly, as the chair of the legislative committee, is, you know, possibly take a position on it.
Yeah, and I mean, they can tell you whether or not it might turn into a 2-year bill, or somebody might, you know, they know what's going on up there with stuff like this as opposed to us.
Yeah.
Okay, any other comments? Any public comments?
No public comments.
Then we'll move on to committee meetings. Legislative Policy Committee. Chair Peraz.
Yes. Thank you. The meeting minutes are on the agenda. And we also have an update from our lobbyists. If you have any questions, I'd be happy to answer that. I do want to give thanks or thank Assemblymember Greg Wallace for successfully being able to secure $500,000 for the fertility clinic in Palm Springs. So that was included in the budget. So gracias. I'm also going to give a quick update. So the state legislature is on summer break. They're going to go back into session August 18th. They're going to be in session for about a month. The last state to pass in September 12th. But those bills that do make it to the governor's desk, the governor has 30 days to sign or veto a bill. And then those bills that are just regular bills, if they don't have an urgency clause, they'll go into effect January 1st. So we're pretty much, you know, a month away from you know, the end of session. Does anybody have any questions?
I don't have any questions, but I just want to mention that there's still trailer bill language to be worked on some things. I know the district in the past has been extremely supportive of homeless efforts. One of the major funding streams has been the Homeless and Housing Assistance Program, or HAP. It was allocated in the budget this year, half of what it's been in the past, so 500 million instead of $1 billion. However, it's been allocated for FY 26-27. So I'm working with the group on the statewide level about expediting the application process. Additionally, it requires a pro-housing designation. I could get really in the weeds here, but I won't. Which the county will not qualify for right now. It's about a 2 to 3 year process to do that. So we're working on some trailer bill language to clean some of that up. And the only reason I bring this up is because the district, and again, housing is a social determinant of health, But just to let you know that some of that we are working on that on different efforts. So.
Any more comments? On to Finance, Legal, Administrative Real Estate Committee. Chair Director Watson.
No updates outside of the meeting minutes. Are there any questions?
Okay, no more comments, no public comment. On to Program Committee, Chair Perez Gill.
The draft meeting minutes are in the packet. Also, the progress and financial reports update is located in the packet. Are there any questions regarding those two items? Then we also have our grant application status report. Are there any questions regarding the grant application status report? And then the grant payment schedule. Are there any questions regarding the grant payment schedule located in the packet?
No public comments?
No public comments.
Okay, moving on to board member comments. I have added a strategic plan consideration for discussion and possible action. I've recommended that we remove funding restrictions for the district low priority strategic goals 5 and 7 for the remainder of the fiscal year. As a reminder, we have 7 strategic goals that we approved in our 5-year strategic plan that is going to be carried over until, because of our consulting agreement we just approved, we're not going to have a new 5-year strategic plan until probably May of next year. So we're operating on the current strategic plan. And the only reason I brought it up is because in the past, the board agreed to fund only the strategic goals of 1, 2, and 4 in the past. And I'm asking that we allocate a small amount of our budget to increase the funding for the smaller strategic plan goals to, what did I say? And that we would allocate 200,000 from major grants and 100,000 from mini grants for a $300,000 total from the grant budget of $5 million. And as Director Delara has always said, that if we exceed our $5 million budget, we can always revisit that. So it's not something cast in stone. Did anybody have any thoughts about that?
I have one comment. I was a little bit surprised that this agenda item was listed under board member comments. It's usually not the place that you would put it, but that's one comment. The second is, I'm just wondering, I'll ask staff, you include in here 1, 2, 3, 4, 5 organizations that were denied because they did not have a higher priority. Were those the only ones that were denied, or were there others?
This was President Rogers' report.
Okay.
Yeah.
Okay.
That was, if you go back you went by a list.
Go to the list.
Yeah, but there's also, at the end of the report, there's a complete list of all the grants that were denied. Those were just some, and they were not all, as Donna has pointed out, all denied because they were low priority. I was informed of this after I looked at that list there, and it gives a reason for their denial. The reason why we asked for this report in the first place was that we wanted to look at, make sure that there was no charge of bias or favoritism. So that's why this report was written, and that's why it was brought to my attention that we denied grants because some of the applicants were low priority, that they did not meet our high priority goals. And I'm just saying, because we have the funds in our budget that we allow the smaller grants, especially the $5,000, $10,000 grants be considered as long as they meet our criteria. I'm not saying that we outright award the grants, but as long as they meet our criteria, that we don't disapprove something because they're low priority.
So what we're looking at then is just changing, just removing the no funding because of low priority. They will go through the application process that would then go to the program committee. And we're gonna ensure that it is inclusive, that anyone that was, that we are giving that same opportunity to everyone that was previously, denied, that they will be reconsidered to go through the process. Because if that list was not, I'm sorry that I made the mistake that I just stopped after the report. I didn't go into the strategic plan, but you're gonna ensure that everybody has the equal opportunity to be considered if they were denied for that reason.
I think what we would need to do if this is approved is that we then go back to the list and then we reach out to those applicants that were denied based on the low priority.
Okay, yes.
So there are several in there that were denied because they didn't meet even certain requirements. So I think that needs to be specified.
Right, and that was pointed out to me after I wrote this report.
And then also, I just want to clarify that staff is following procedure and guidance from the board, that, because I get a little uneasy with some of the words and I don't think you mean them that way, but they come across that staff was being prejudiced or
that was not the meaning.
Or biased in the decision not to approve. They're only declined based on what the strategic plan and the guidance from the board is. So just wanted to make sure that that was highlighted.
Yeah, and I just was a little bit, I needed clarification because when I saw that list of 5, I thought there couldn't have just been those 5. And so that's why I was confused. So thank you for clarifying that staff will go back and look at and which ones that were denied based on that one issue, and that they will go through the whole application review process to then be rated and then be go through the process.
And going forward.
Yeah.
And then to clarify
I have
too,
a question.
once we meet the $200,000 or the 100,000, then we're okay to cut that off then, or because I don't want to create a problem.
How do you prioritize?
We can always revisit that. Our budget is not cast in stone. We have some director comments.
Greg had his hand up.
Yes.
Kimberly.
If we approve this, will we be notifying those organizations that we denied, or are we gonna let them know that we've changed our, I don't want to call it a policy, but and that they're gonna be, that they can reapply? Are we gonna be doing any sort of communication?
I think that's what we were just saying, is that
Violate AB 2019. We are going back.
And also,
Well, I mean, we could put a letter
These are
out there. You
all
have some,
things that
we could have,
previously
you're
declined
welcome to.
grant.
There's some discussion going on, Director
It's
Barraza.
going to be soliciting. So
Well,
hey, go apply.
I mean, I'll look at that, but I mean, I think, you can open it up. You can put out some type of initiative or communication that indicates that the board's changed policy on this or something like that.
I think
Just
that
make
would be
them
cleaner
eligible.
that way.
Huh?
I think that'd be cleaner that way. That
Yeah.
just an announcement that would go out
Yeah.
that the
Okay.
priorities.
Good point.
Did you hear the answer to that, Director Barraza?
Yes, thank you.
All right. Director Rodriguez next.
Yeah, so I'm okay with this right now. I just want to pose a word of caution that as we go into strategic planning with considerably amount of more money, is that we're not opening a can of worms or Pandora's box that we're going to get all these mini grants. So I just, again, I'm supportive of this right now because the money's there, but I think as we go into strategic planning and if we're setting priorities, is that if we are eventually going to go down and open up lower priorities, that there has to be some real guardrails put in place on this. Because as I said in my campaign, and as many of us have talked about, is everybody thinks that this, 600 million over the next 30 years is going to open this huge funding opportunity for mini grants, which is not going to be effective. So I'm just providing that word of caution. So
I hear you, Director DeLaura.
The concern that I'm now starting to be concerned about is we want to make sure that we're being fair to everyone. And that's why we want to go back and look at the ones that applied. But what about the organizations that didn't apply because they saw it on our website that it was a low priority and therefore they didn't apply? And so we're changing the rules at this date going retro. I don't feel that that could be a problem. So I'm feeling a little bit uncomfortable with that. So
I think that we're just talking about July 1 forward.
Oh, but then just to put something on there that our priority has changed so that they have to apply new, not going back and looking at the applications that were and only.
Yeah, it would be a new application. They would be eligible to apply if we're going this route.
Director Perez-Gill.
I have a comment. I think that the staff does a good job of following the guideline that we set forth and that we all approve for them to follow, right? Their work process, workflow. I think they do a good job about that. I don't think we've ever had any problems before. At least I don't think any big problems. I think that we should wait until September when we start doing our new strategic plan, because I feel like this is going to bring out a lot of other problems because of what we want to change. A lot of people are going to feel like we're not being equal. Why didn't we do this 4 years ago? Some of the issues that we're seeing now are issues that were here 4 years ago when we made the years ago when we made the strategic plan. And also, we still don't know what changes are going to be affecting our community or what barriers are going to be coming up with the new change of all the laws and everything else. So I think it would make more sense that we wait until September. That's just my opinion, but.
Any more comments?
Just a question to staff. If this was approved, do you believe that it would create way much more work for you? Because I know that we're coming into some busy months, or we're going to be busy. I'm just wondering if you have any thoughts or opinions on that.
It really will increase some of the workload, and it's going to overlap with our work going into the next several months with strategic planning and workshops and with the efforts that staff will have with working with the consultant and navigating through that process. So absolutely right. There will be some increased workload in doing this, parallel with the strategic planning. One other comment I would like to make, and I think it might be a minimal concern, but also bring to attention, we still have, litigation pending on the OPA. And I doubt that that's going to change what the lease would be and the 650 million that we're talking about. But we also have to keep that in mind, that if anything were to change with that, it does change what we're doing in our strategic planning. So, hopefully we'll learn more about that in the near future as well.
Do you have a comment, Dr.?
Well, I appreciate you bringing it up to the board just these lower quote unquote priority items, not that they're low priority to the organizations. I would like, my biggest concerns, I think Chris mentioned one is the contention to what was done in November. That always concerns me until you have an official ruling and that we're good. I'm pretty sure we are, but until it's finalized in paper, I worry that what we're planning for could be taken away. Number two, I would like to know the financial impact of this. I think we have a budget in place. We are fortunate we have a surplus, but at least the way I like to run, whether it's my business or my personal life and how I'd want to run this is I'd like to look at what the financial impact is for us going forward and what we think these mini grants approvals are going to be. I think we've allocated $5 or $6 million this year for grants. We're going to have some money left over. If this is something we want to do, I'd like the financial committee to take a look at it. I'd like Eric to look at it and just make sure that, all right, do we have a certain amount that we want to open up to these grants? And is there a way we can qualify one versus the other? Because if we open it up completely, I just want to know what that does to our budget, because we're fortunate now that we're in the surplus. But, a good example is Palo Verde Hospital. They were in a surplus and now they're not. And those are all based off of financial decisions they make at some point that then they pay that debt down the road. So I'm for supporting things like this, but I just want to know the long-term impact. And with strategic planning coming up, I know we say that. I know we say like we're hiding behind that, but we're so close to coming up with like how we want to handle all these issues with what we do have that I don't want to rush, make a decision now. But I would say if there's anything on here that is absolutely critical to meet a critical need, that maybe we give consideration to pull that out and look at it again.
So are you suggesting to forward this to the finance committee?
I would like to have the finance committee look at, and the program committee needs to look at it too, to look at the workload that it's going to take to address these. And then do they have an estimate of how many of these may be coming in so that the finance committee can look at it and say, well, if the average number is $20,000 or $30,000 and we've got 40 of these, we're looking at $1.2 million. So, I like to budget that and plan that so that we can forecast it into what we're doing if we really plan. So approving it today, I have trouble with because I don't have numbers that I can back up that we can do that from the finance committee. And I don't know if you can answer that question today, Donna, what the workload increase is to your staff. I know we're hiring people, but I want to keep focused on our priorities here, high priorities. If these are important, I want to address them, but I want to make sure we can address it further.
So Donna, the question is workload on mini grants. I know that you usually turn those around in a very quick manner.
Mini grants they're staff approved. Things go forward to program committee for approval. It's anything over 10,000 goes to the board. And that's the grant policy that staff is allowed to approve mini grants.
Almost like a sponsorship then?
Sponsorships are.
Well, I mean, almost like a similar thing where the program committee does.
Grants are like small initiatives, like small health initiatives. We do give them performance measures and they have deliverables, but we do assign performance. Okay. So we are tracking them on our RBA dashboard. So, let's make some kind of impact. And a lot of organizations, they can't even handle anything over 10,000, or they basically don't have audited financials. That's why a lot of organizations do apply just for mini grants because they don't have audited financials.
Well, go ahead.
No, I was just gonna say, the workload, who's to say, Director President Rogers has allocated 300,000. So, that could go into staff, could have, $100,000 worth of mini grants. They can go in with 2 or 3 months once the work gets out. We've got other grants as well. So you can have one person come in for 200,000 that wants for housing or food insecurity. And you're done.
And be one grant.
Yeah.
Mm-hmm.
And that's my concern when you said earlier, because that's why I was trying to identify if we're specifically doing 100,000 for mini grants and 200,000 for the larger grants. That's well and good. But if it comes to a deal where we've got all of these requests and then you said, oh, we can add more to it, that concerns me because we've got staff then that's going to be working pretty significantly on the strategic planning going forward. And then if we have to keep coming back and you're going to authorize more dollars, I think you got to look at the effect that has on staff and getting us through a strategic planning process, not only for the next 5 years. We need to be looking at what is the district going to be in 10 years, 20 years? And granted, that can change, but is that worthy of impacting what staff's work is just to make this situation happen today? That's a concern that I have.
So you're saying that what would be the best way forward is to put these numbers as final numbers, and that we don't, that we stick with them within our budget.
Yeah, because if we continue to just open this up, it's like, Director Rodriguez was saying, I mean, to me, it's a can of worms because, and Director Delara had indicated too, you're going to have grantees that would have applied had these been open before, and now they're going to look at this as opportunity to apply, which they're not invalid goals, they're not. But for purposes of the grand scheme of things, for what the board is going to have before them and staff moving forward over the next several months, and we're going to be doing workshops with DEI and governance, as well as we're talking probably about 15 workshops for the strategic planning process, not only just with the board, but also for our community. And I'm not saying that to downplay, I just want us to be most efficient.
And President, I would like to make a motion to deny or to not approve this. I just believe that this is not, that the process is not clear. I don't want to create a process reacting. I would have rather be more proactive. I didn't like the idea of not being able to fund the low priority, but at this point, I do not want to create a problem. When we have, like Director Rodriguez mentioned, we have to look forward, not look back. And so I am making a motion to not move forward with this.
Well, I think that if you don't get a motion, that we won't move forward. So
I'm moving that we say no. If there's a second, then we'll move forward.
I don't think we need a motion. I think we just don't approve.
This is action required.
My final comment is that it just looks bad to the public that we're sitting on,
But it also looks-
$650 million in reserves, and we're denying a $10,000 mini grant to organizations such as this. It just
Yeah,
looks-
but we're planning for the future. So I don't think it looks bad for the public at all.
It also looks bad. We switch up now that we're about to do a new strategic plan when there's only 1 month away. Yeah, but we're gonna we set these guidelines that we're following now. We agreed, you were there, she was there. We agreed to the things that we're doing now. If we change that, we're giving mixed messages to the community too, and to the people that come and ask for money. If we're doing something, we need to follow that and follow through on it. Like, it's like when you give your word to do something, you need to do that, or else, you don't.
I did.
That's a good point. And that's what I think. I mean,
So is there,
I'll second the motion.
there's an agreement that we're not gonna move forward on this, correct? Correct. Do you still want it to go to the Finance and Program Committee?
We would be happy if the program committee, everybody who's going to look at these mini grants thinks this is valid. I would like to run it through the finance committee. It's not necessary we do it ahead of time until they give us numbers of how many they think would be approved.
Well, I think if we're not moving forward here, that's a moot point.
Correct, but that's correct. But the finance committee is not going to reject reviewing it.
Right.
Okay. All right. Any more comments? Any more public comments?
One comment on the Palo Verde situation. Is our mobile health clinics an option to go out there to help? I don't know what their need is now. I haven't heard.
Well, they have there are some mobile health clinics. Challenges, it's outside of our district boundaries. Number one. And number two, they've got a community health clinic and another FQHC out there that is serving the low acuity needs. That's more preventive
So you don't think there's a gap in care there in what the mobile clinic here that ours could cover?
Yeah, none of.
We can't do it, Dan. It's not our jurisdiction.
Outside the district.
It's too bad.
So but the county is talking about, I mean, we have our own mobile clinic challenges too, but I mean, there's other organizations working on it, but the district cannot do it. It's outside of our jurisdiction.
All right, that's good to know. Thank you.
And a couple of the ideas that were floated around in the ad hoc committee is if there's opportunity legislation wise to be able to create rural emergency hospitals. Or as was said by Michelle Finney, FUHC on steroids.
Why couldn't the foundation support it?
Out of our area.
Oh, but the foundation is a nonprofit.
Still tax dollars that are.
I mean, I don't want to go into it.
Yeah.
I'm happy to talk to you offline.
So we got fine. I just had a question. That's what I was thinking. Like, there's a district that's elected and then there's this nonprofit foundation, which is limited by jurisdiction.
But it's still taxpayer dollars within the.
Not all of it.
There
Some
will
of
be
it's
a
grant money.
in the future, but we need to let staff tell us when the time is and the workshop or board or the agenda on the board agenda, an item. But it's not appropriate to continue talking about this at this point. We have a motion on the second, right?
We're not motioning anything. There's nothing to vote on.
Is it necessary to vote? It was discussion and action.
There's a motion and a second on the
For what?
floor.
We're not even taking it to action.
For carrying out the motion. If
For no action.
If I wanted to withdraw my motion, then there would be no action needed, but I'm not choosing to withdraw my motion. I just want this to end.
I understand. My only question to Jeff was that it was on the agenda, it says discussion or possible action. And then if action is necessary, if the board just comes to a consensus not to move forward and carry it over to the FNA.
There's a motion and a second, so I determined the action was necessary. So there's a motion and a second.
Sorry, was there a second? Sorry, I didn't.
Okay, well, all right. So Director Perezquio?
Yeah.
Secretary Barraza?
Well, Andrea, can you confirm how we're wording it?
To not move forward with this at this time.
Yes.
Okay. Director Delara?
Yes.
Director Loxton?
I don't know why we're taking a motion for no action. Just don't bring it at all for vote. There should have been.
Procedurally, there's a motion and a second, and it is a possible
I'll vote
action.
no, because I don't think you need it.
Yes.
Are you voting no on the motion?
There doesn't need to be a motion.
Correct. He's voting no on the motion.
Who's next?
Director Shore? Director Shore, will you have your mute on?
Sorry.
I vote present.
Okay, abstain. Vice President Rodriguez?
Yes.
President Rogers?
No.
And did you want to abstain? Also, you have no vote.
Yeah, just abstain. That's fine. I didn't know.
Okay, so the motion.
Are there any more board comments? We take a 10-minute break and come back to foundation.
So it's 9:40 on the East Coast here. I'm starving to death, so I'm not gonna make the foundation meeting. I'm sorry.
Quick, right? You don't have much later.
Yeah.
I don't think there's any action items, so we can excuse you.
Yes, back there. It's 77.
I'm going to happy hour after this.
I'm joining you. I just. I know.